I would like to just very briefly introduce our panelists and then hand it over to Gail D. Mumford. So starting with Gail D. Mumford from the Annie Casey Foundation is the first person who's with us here today. We're very excited to have her participation. She's been leading this work around detention conditions um, and youth justice with our organization and a number of organizations via the Annie Casey Foundation. We also have Dr. Portia Heyman from Cafe Momentum in Dallas, Texas. She's the chief program officer there, and she also has participated as a community member on a detention assessment team. So we're very excited to have her join us. We also have Rick Gaines, who's the chief juvenile officer at Family Court in St. Louis County, Missouri. Rick his facility went through a self-assessment using these tools, and Rick also participated as an external assessment team member on a second assessment. So we're very lucky to have Rick and his experience specifically with these tools, but even his broader experience running facilities and all of the challenges that entails. Then we have Jason Zaney, who is, boy, been in this space for a long time and has knows facilities inside and out. And we are lucky to have him part of our team at Juvenile Justice Advocates International as a consultant and working on specifically on detention condition pieces. And then also Beth Oprich, who is also working with us as a consultant on detention condition issues, and she's has run facilities in the past and been very involved with initiatives like the JDAI initiative. So we're lucky to have her as well. Again, my name is Douglas Keeler. I'm the Executive Director of Juvenile Justice Advocates International. With that, we're going to just go ahead and kick it off. We'll end this first poll here in just I'll give people a couple more minutes. I see people are still answering, but I would like to hand it over to Gail D. for our to kick us off here.
So thanks, Doug. Can you hear me fairly well? Everybody good? So I don't know how many millions there are on the call today or how many less than a million are here. But for all of you that are here today, I'm definitely glad that you took space and time in your day to enjoy this or join this conversation with us. I am in my mobile office today because life decided to life a little bit last night, which forced me out of the office and headed south to North Carolina to attend to my mother. So, but all things aside, thank you so much for joining and for caring about or have an interest in this critical conversation about the conditions of which young people live in. Now, there are some things that lessons have taught us over the course of all of our engagement. I don't know, collectively, we might have about 300 or 400 years of experience. I don't know. But we know that there will be a time where young people will be away from their families. We also are aware that where young people live, where they are held, how they are treated, and how they are engaged has significant and lasting impact on them as individuals and to their future and to their careers. And so I've been around the Casey Foundation for a great number of years. Long before I arrived at the Casey Foundation, the Youth Law Center and the Center for Children's Law and Policy helped the foundation design condition standards, which helps us take a look at, okay, what is happening with young people? Is it clean? Is it safe? Is there programming? Who is engaged? All those important and critical things while the young person awaits their day in court. And that has continued past our direct engagement with Youth Law Center and then the transition of the Center for Children's Law and Policy. Doug Keeler and the Juvenile Justice Advocates International should not be perceived as new ones coming to this conversation. And they've been around conditions work long before they became engaged with the Casey Foundation. If history serves me right, they did some research and discovered the standards and had several aha moments and then invited a group of us to go to Mexico to talk about conditions. And not only have they been curious about these conditions, but they've found a way to promote them across this country and outside of the United States. So they are becoming new partners with us in this work. It is not going away. work is not changing. We still care deeply about the conditions where young people live, and we care deeply about the adults that are in charge of them, and that will not diminish. We are not having this conversation or reviving this work because of any sort of things that's happening in the climate, be it social, be it political. We are having this conversation and continuing this conversation because it matters. And even beneath it mattering, what we're discovering lately is why it's becoming to matter more is because numbers in detention are starting to tick up again, right? And we know, all of us know, that when the numbers get high, there can be sort of compromises and sacrifices that happen that in the end sacrifice safety for young people, and we have to keep our eye on those things as we manage the transition of leadership, as we manage what happens in social and political climate, as we manage staff who can and can't get to work, as we manage staff coverage shortages, all those things. We want to keep up front and foremost at what is happening with the young people. There is this thing that's been age old called the My Child test. I have great respect for that, but these are not my children. These are someone else's children. And while I have a way that I want to care for my own, I want to extend that to other people's children also. So thank you so much for joining us today. Please stay through the conversation. We're going to talk to you about some of the developments in the work, some of the places that are doing the work, and in the end, how you can raise your hand to say, we're interested in some level of support. So thank you so much. Again, I can't apologize for being in the car because life is life, and I don't know where half of you guys are. So have a great conversation at some point. I likely will go off camera, but I am interested, engaged, and involved, and I hope for a productive conversation. Thank you, Doug.
Thank you, Gail. I mean, that speaks as much to Gail's commitment to this issue as anything that she's joining us from on the road there and values this conversation, this issue to that extent. So we thank you for your leadership, Gail, and your participation here today and the continued commitment of the Annie Casey Foundation to this work and in particular to the kids, to the youth um, who need these initiatives to go forward and be successful. So uh, we are, I'm going to go ahead and launch the second poll. We're going to have two more other quick polls. They're each just going to have two questions each. We're going to talk a little bit about challenges around um, facilities and youth who are in facilities, and then talk about opportunities. So we're not going to leave you hanging there with just challenges. So give folks a minute if they want to go ahead and answer those two questions on your poll there on the screen, and give you just a minute to go ahead and do that. And while you're answering that poll question, I'll just insert that I get a news alert from Google. You can sign up for Google News Alerts, and I get a news alert every couple of days just on juvenile detention. And there have been now just I think yesterday or the day before more scientific studies come out about that this is really an issue, but you can see just on my news alerts that the prevalence of issues coming to light, old issues coming to light, now current issues coming to light in facilities, the issues that Gail talked about with the numbers going up, issues around the pandemic and staffing issues that were exacerbated during that time that are still with us today. So I think all of that makes this an incredibly important time to be talking about these issues, and the fact that we have as many people logged in today to be part of this discussion represents your acknowledgement of the importance of these issues and your that level of commitment to improving those issues. So with that, we'll go ahead and leave the poll open. But now I want to hand it over to Dr. Portia Heyman from Cafe Momentum, who, as I mentioned, was part of a community member as part of an assessment that we conducted. And we'll say this was a kind of a joint assessment done with community members in Dallas County, Texas, and then with our organization. And I only mention that because the facility has been very transparent, even in the media, about the assessment being done and our team being part of the assessment. So, these assessments aren't public necessarily. They're for the people who run the facility to use it to improve the facility. So I don't want to have anyone feeling like we're putting Dallas County out. We're outing them. This is all out there already. Anyway, so Portia, I'm so glad you're here with us today, and I would love for you to share some of your experience around being part of the facility assessment and what kind of brought you to that process and what that process looked like as someone coming from, literally the outside.
Of course. Hi, everyone. I'm Dr. Portia Heyman. And as Doug mentioned, I am the Chief Program Officer with Cafe Momentum. Here in Dallas is where I'm located, but I work nationally with all of our locations. So maybe one coming to a city near you, keeping the eye out for that. But I am also just a concerned community member, involved and intrigued about what's happening to the young people who are in the detention facility here in Dallas specifically. And as Douglas mentioned, there is no outing of Dallas County. They've been on the news quite a bit. In fact, the facility was on the news last night, but in a positive way. Some of the more recent improvements were being discussed. And though I can't give all of the praise and everything to this assessment, I truly believe that this assessment played a part in that. And I say that it played a part in that because there were lots of things happening in the Dallas County Juvenile Detention Facility, and people were talking here and there, but what didn't exist was a succinct explanation. There was nothing to guide the staff members and the leadership who did actually hope to make things better. There was this desire to make things better, but there was no direction. And so what this assessment offered was just that. It offered direction. It offered insight from individuals who were not a part of it. Sometimes it's really hard to see what's going on in a facility when you're in the facility. You can only see what you can see. And so what Dallas County did was they were so transparent and allowed for our team to come in to be a part of this assessment and see what was going on. And I'll be honest, when I got the call to be a part of this assessment team, I said, I have no idea what I'm getting myself into. Because like I mentioned, there were things in the news and there were concerns and people were saying different things. And so I had no idea what I might see. But what I realized was that Dallas County was saying, come see, come truly do an assessment, and their transparency and their willingness to cooperate with this meant a lot. It meant that they were on board with trying to do something different, trying to improve. And so Doug and Beth spent a lot of time teaching me about an assessment, what to look for, how to score things. It was great. And so then I had the opportunity to go into the facility. I talked to staff members. I talked to youth. I observed things. I ate dinner in a juvenile facility. It is not ever something that I thought was going to be on my bingo card, but I did it. And I learned a lot in sitting down and having that experience. And so now when we are able to provide a report to the facility leadership, it's not based on what we think. It is based on what we actually saw, what we actually heard, the experience that we had, all with the idea of making this facility better for the youth who are being served there. And externally from this, I work with young people after they come out of the facility. And so if conditions are better for them while they are in the facility, imagine how much better that is when we begin to work with them outside of the facility. And so selfishly, being a part of this was like, oh man, this is going to help me with the youth that I'm going to serve as they come to Cafe Momentum. But to Gail's point, these young people are our young people. Like, I am a community member here in Dallas, and I want what's best for all of these young people, because these are the young people who attend school with my daughter. These are the young people in my neighborhood. And this was an opportunity for me to be an active participant, to learn about what was happening, and then propose a plan as to how things could get better. And yeah, there were areas that were discovered about how improvements could be made. But like I mentioned, even just last night, there was news about improvements being made. And for me, that is extremely encouraging from a professional perspective, but more so just as a community member. And so I was thrilled to be a part of that. And, even thrilled now to be here to talk to all of you about potentially an opportunity that may be presented to you for your community to benefit from an assessment such as this. So I am thrilled to hear more about conversation and be a part of that conversation and answer questions as they may come up. But that was, I mean, that was the gist of my experience, what I learned, how I participated, and what I am hopeful for here in Dallas and just for young people in general. So, back to you, Doug.
Thank you so much, Portia. Portia was one of a number of community members on the team. She wasn't just and maybe you want to speak to that a little bit, that you felt tokenized, you're the token community member, or what that looked like on the team.
Yeah, sure. Like Doug mentioned, I wasn't the only community member. In fact, the community members that were selected, it was done in a very strategic manner because the principals look at lots of different areas. And so ideally, you have community members who are, I'm using air quotes to say experts, as much of an expert as we can be in various areas, because that lends itself to insight. And so there were a host of us who had different components of the assessment, different components to look at and to gain better understanding of, so that collectively we could present this information. Now, I did feel honored to be chosen. I will admit to that. I was very, very happy to be a part of this. But I do think having multiple community members also lends itself to really how this assessment is done. Like, you're not just taking 3 people, right? You're taking a whole host of people who've had different experiences and putting that all together. And it's like the more ingredients you add into the stew, the more viewpoints you have in the situation, the better it turns out. And I think that's exactly what this provided for us. And the community members, none of us knew what we were getting into. None of us had any idea what was gonna be expected of us. But the time that was taken to help us understand that, I was terrified initially, but then you walk in and you're like, oh, I got this. I didn't really have it, but I felt like I did. And it was a great experience. And I'm going to speak for all of the community members because we have also spoken. I think they would all say the same, that, it was an exciting opportunity and we got the support and the encouragement from the facility to move forward and do this effectively.
Oh, that's huge. That's huge. We just found the clip. We put it in the chat so if people want to see the news clip from Dallas, and and Beth, who will be speaking in a little bit, also give her the opportunity at that point to talk. If there's other pieces that she wants to share specifically about the Dallas experience. So I think I'm gonna close the last poll we just did. We got 75% participation on the poll, and this is the first time I've ever run a Zoom poll, I'm gonna be honest. So I'm supposedly sharing the results with you all of the poll. So this is all just very interesting. And I haven't had too much time to look at kind of what people are saying, but staffing is coming up as a big challenge, which is not surprising at all. That staffing is the top challenge, and that also that there's a little bit of a split on the community engagement question between somewhat strong and pretty limited. So I think that's also pretty representative, right? That it's pretty common to encounter facilities that are really trying to leverage the resources in the community. And even in Dallas County where Portia was working, a lot of the other team members that were part of the assessment team were part of an organization that currently or before the pandemic really had been pretty involved in Dallas County. And so, a lot of places may even be some of those relationships where there's currently really limited engagement, but some of those older relationships that you could reactivate, and try to work on that engagement piece. So all right, that's the poll results for our second poll. We'll throw up the third poll in just a few minutes. Before Rick talks to us a little bit about from the facility perspective, just want to give a little bit more context to the assessment pieces. So this assessment methodology is not mandatory, is not required in any specific state in the United States, although some states have integrated these standards and very similar standards into their state requirements. So that is pretty common. that it's because it's been around for almost 30 years that it's started to kind of filter into, when those regulations or laws are revamped, they look at what's out there. And this is by far the highest bar that exists for looking at facility conditions for youth. So even if you've never heard of the youth, conditions of confinement standards or what used to be the JDAI facility standards, you may read through them and say, "Oh, this looks pretty familiar," based on some of your state requirements. But I can almost guarantee if you go through you'll see that eventually you'll see that the bar is really trying to pull that bar up. And so the intention has been that facilities who want to employ best practices, go beyond those minimum standards, would conduct what's called a self-assessment. But these tools also can be used in an environment like we did in Dallas County or in other places that Jason's been very involved with in particular, where it's more of a hybrid or external assessment coming in and doing an external assessment, but all with the intention of providing a pathway to try to reach not just better conditions, but reach those best practices in all areas of the facility. So with this version of the standards, the 2025 version, they're streamlined. They're about half as many actual standards without lowering the bar, but also a renewed emphasis on community and in particular family and youth engagement in the standards. And so really looking at families as partners even when kids are in detention. So, just paint a little bit of a picture for you about the launch of this version of the standards and kind of where that's coming from. Now, with that being said, I'm going to go ahead and hand it over to Rick in St. Louis County, who has become an expert on the 2025 version because he was one of our pilot sites. So, Rick, tell us about what this looks like from the perspective of someone who runs the show there in St. Louis County. Why in the world would you raise your hand to do something like this?
Yeah, welcome everyone, and appreciate the opportunity. I'll just have to say thanks to Gail D and JJ Advocates, because a little bit about me. I started out in detention as a detention deputy juvenile officer some years ago, and worked my way through, became the chief juvenile officer in a community of about 150,000 people. And then lastly, I was the superintendent of our detention center in that jurisdiction of about 150,000 people. So my last 4 years in that jurisdiction, I was superintendent. And yes, it's a challenge. I retired once, and so I came to St. Louis County, which has about 1 million people. So you're talking about 150,000 to 1 million people in St. Louis County. And when I was presented to this opportunity, I'll tell you the truth. I was like, not only no, but no. I was not willing to allow my center to be assessed because I never knew what I was going to get into. You never know what you're going to find, right? And at that point, we were in a really a unique situation, kind of like what Dallas County was in. We had a lot of people coming to us, a lot of community people coming to us, a lot of our county council members coming to us, telling us, parents coming to us, telling us, "Hey, something's wrong with your detention center. You are not treating kids the way they should be treated. Kids are making complaints. Staff are leaving these kids in their rooms for long periods of time. Your administration team is not talking to parents. Kids make complaints, and you're not doing anything about it." And so it actually was a perfect timing for us to say, "Doug, we need this. We need this help." And Gail provided the supports for us through the Annie Casey Foundation to make this happen. And I'll tell you from my seat, because I'm the chief juvenile officer in St. Louis County now. I oversee our detention center, and I want to make sure our detention center is one of the best in the state, if not one of the best in the nation. But in order for us to do that, I had to leave my ego at the door and say, I am willing to allow community folks into my center. I'm willing to allow eyes on total openness and transparency so that we can get a better handle on how to improve services within our detention facility. And because I'm telling you, we were at a point where I think the community was looking for us to say, we need to get rid of several of these folks who's running this detention center because there's too many problems coming out of this detention center. And so we took this opportunity as a chance to show people what we're doing and to show people that our staff are committed to what we're doing and to show our community and our parents, hey, if we're not doing it right, please show us what we're not doing and allow us to try to improve on this. So this was an opportunity for us. And Missouri has its own detention standards. And so we call ourselves complying with those detention standards. But the opportunity to go through this facility assessment allowed us to be open for criticism, open for things that we're doing well, open for things that we may need to modify in our policies and our standards and our work. This was the best thing at the time that we were going through a lot of these challenges in our detention center. The best thing that could have happened to us under those circumstances, because we were saying to our families, our community partners, our local government, we want to be open to a assessment that rates us on how we are doing on these factors that the assessment center will take us through. And we got a lot of our community partners to support us. And some of these folks, they're going to come in saying, you're doing terrible things for these kids in detention. And some's going to come and say, we would support what you do. But the whole essence of this assessment allowed us to really dig down into above and beyond the Missouri standards. But, we're talking about, close to 500 things that we had to take a look at in our own policy. It was work, but I tell you, as we were going through this, I really eased my anxiety because I felt like I had the supports from Doug and his team, in particular Doug. And if we had questions, we had that support. If we had opportunities to say, I don't think we're doing some things. Is this support how we're supposed to do this? We had the support all the way through the assessment. And I looked at this assessment first as a challenge, but as we got to doing this and our community partners a part of this opportunity was, I felt like a load of walking bricks off my shoulder because it allowed us to gauge where we are and to then put in things that I had never even thought about in a detention center, in particular with my parents, my kids, my community partners. It allowed us to say, Rick, you are doing this on your own, but you need to have some supports. This detention center can't be just a juvenile court work session. This has to be a community partnership to run this facility. So we allowed ourselves to open that gate. We've got programming. I mean, I've got people coming to me saying, Rick, we don't do programming in your facility. It's been amazing. We have meetings with our parents on a monthly basis because we said we don't want to wait till the crisis starts. Let's hear from our parents way before we get to a point where now there's an explosion coming out. We're having a lot more opportunities where when parents are coming to our door and kids are coming to our door for the first time, we reach out to those parents to meet with those parents and give them information about our facility. We're not waiting for them folks to come in and say, I'm afraid what my child is going through, because when kids are coming to they do not know what processes their kids are going to go through. And even though these kids might have been, hell on wheels in the community, in detention, it's a whole different story. So this assessment allowed us to really take a look at what we're doing, how we're doing it, bringing more people in to support our kids, bringing more opportunities for kids to have programming, bringing more opportunities in for kids to not sitting there in their rooms or in their cells on a continual basis, an extended period of time. This assessment will help you understand this. Treating kids, you can't do this like it's a mini jail. You have to treat kids with treatment, opportunities for competency, opportunities to feel like they have hope in a chance for growth while they're in the facility. And so this I cannot say enough about the supports that I believe our facility has engaged through this assessment model with Doug and his team. And we have adjusted our policy to address all the things that we fell short on the assessment. And we didn't fall short on everything, but we are addressing our policy and our practices to address what the assessment module says you should be doing for best practices. And with that, I have seen a really sense of culture, change of culture in our detention center, a change of just our staff environment and how they're coming to work and how they're showing up. Again, we still have challenges. I'm not going to be to tell you that we don't. But even the challenges through this assessment piece have been less anxiety to work through because we have opportunities to bring in different people, different partners to support our kids and our families that we had never really done in the past. And I take this opportunity to tell you that a detention center cannot be ran like an adult jail. It just can't. And if you're doing that where kids are just waiting for school opportunities and then back in their cells without a lot more of engaging these kids, um, you're treating kids in a way that is impacting their own uh, growth opportunities, trauma issues and anxiety. You've got to be able, this assessment tool allows you to really dig deep into your methods of operation that at least has allowed us to really feel better about when we receive kids. We're going to treat these kids with dignity. We're going to reach out to their parents. We're going to open ourselves up for scrutiny. We're going to be a lot. We give people opportunity to meet with us, opportunities to talk to us. And I would tell you, and I told Doug this, the next time we have this assessment, we're going to be 98% or better on all the A categories that we are undertaking, because that's the emphasis we put on in making our facility as best facility that we can run in the state of Missouri as well as across the nation. I am proud of what we've done. I am proud of the work that Doug and his team allowed us to kind of piggyback and they held our hand working through it. But as we got to doing it, man, it was just well worth it. Our detention center is better for it. Our kids are better for it. And I think our community as a whole has a lot more confidence in us providing the services for our kids and their families, more so than what we did before we did this assessment. It was just an opportunity that I thought was it was just perfect timing for me. Again, I had to let my ego at the door because this supports me, not trying to do things that says, okay, you're doing so many things wrong. This actually supported us to try to make our facility a better place.
Well, thanks, Rick. If you can believe it, we don't pay Rick anything. No, I think he what there more is to say. I know we got a lot of folks on the call who are running facilities, and so jump into that Q&A, ask questions. it's a big step, but I think Rick and Portia really showed that being willing to take that step shows a lot about your intention. And with that, and opening the door and leading your team with that same intention towards this, then bringing those standards, bringing the community in with this structure around it, you know, it starts to assuage those concerns and gets people to work all working in the same direction. So, Jason, how did you do it, man? Talk to us about the new version of the standards and a little bit about how we got there for people who've been part of JDAI, I suppose, in the past, and then people who don't have any idea what I'm talking about when I say JDAI.
Sure. Thanks, Doug, and hi, everybody, and thanks for making time for this conversation today. Yeah, as Doug mentioned, I have a long history with the JDAI standards and conditions of confinement. It's when I was at the Center for Children's Law and Policy, where I've spent most of my career. Conditions was really one of the major focuses of my work, and it was work that I really enjoyed. Oftentimes, we were encountering facilities with serious challenges, with allegations about mistreatment of youth. That obviously wasn't positive. But what was really encouraging to me was that there was a methodology and an approach to help jurisdictions acknowledge some of the things that weren't working or working well, and to work to make those things better. And so I see many folks who are in the webinar today who may have been part of teams who were trained by me and my colleagues at the Center for Children's Law and Policy and the Youth Law Center 10 plus years ago, as we would go around to different states and jurisdictions to train folks on the JDAI standards so that they could go in and assess conditions in their facilities. That was fun work to do. It was great work to be involved with. But as the JDAI network has expanded and scaled up, it just wasn't possible to be in as many places delivering that training. So we had the good fortune and support from the Casey Foundation and from Gail D. In particular, to think about how to deliver that training and those learning opportunities in a different way. And Beth Oprish, who's on and who will be talking to y'all next, was really amazing in terms of helping us figure out how can we make some of these knowledge building experiences more accessible, enter the 21st century and use technology to do some of that, as opposed to everything being reliant on live instruction. And so we started to make steps in that vein. And then I am just really thrilled and honored to be part of this latest phase of the work with Doug and Daniela and Sarai and the team at JJAI. I mean, you've heard a ton of positive things from Portia and Rick about their experience with Doug and his team. I want to underscore that. They've been fabulous to work with. If you're not familiar with JJAI and their work, it's amazing. They are really focused on engaging and working with the communities in which they work, including in Latin America. So just a plug to take a look at their broader work, but they've really taken on the charge of making this process more accessible and more impactful and available to more jurisdictions that are interested in taking on this approach. So thank you, Doug, and the team at JJAI for doing such a thoughtful job with the revisions to the standards. I'm going to be very brief and give you 3 things that I think you'll notice have changed a little bit in the 2025 revisions to the standards, and then one thing that hasn't changed. So first of all, one of the things that I hope you'll notice is that the standards are really centered more in youth well-being and family well-being and experience. What do I mean by that? I think if you look at the 2025 standards, you're going to see standards that more directly focus on the lived experience of youth and family members, as opposed to standards that are focused more on technical aspects of compliance with various aspects of facility operations. Those are important. There are state licensing standards that touch on those. There are other sets of professional standards that get more at operations issues, but this is a set of standards that's really designed to hone in again on youth well-being, family well-being, and I think that's an exciting lens through which to be doing this work, and honestly the right lens through which to be doing this work, because that's what matters most at the end of the day. I do want to recognize that we had the benefit of working with some of the Casey Foundation's youth fellows. We had so many focus groups and conversations with folks from the JDAI network that helped inform those revisions and helped us really burnish that lens through which the standards were revised. So I want to give, there are too many to count, but give recognition to the folks and the time that was spent in revising the standards. The second thing that I think you'll notice, that I certainly notice as someone who's used every iteration of the standards as they've evolved, is that, as Doug mentioned, they're streamlined. This is important for a number of reasons, but one of the key ones is, again, we really tried to focus on honing in on the most critical aspects of a young person's experience within the facility. And we also wanted to make this process more accessible for folks, so that it's not something that's done once in a blue moon or something that is never done because the process and the standards seem so overwhelming. So you're going to see standards that are no less rigorous, but you're going to see them consolidated and streamlined to focus, again, on those key areas. The third thing that hopefully you'll notice is, and this touches part on what Beth's going to talk about with respect to the process, but you're going to see standards that are framed in more accessible and easily understandable ways. And part of the goal there was to help open this process up so that we do see the kind of community engagement and partnership that Portia was able to be a part of in Dallas County. We do ensure that we're bringing in those community perspectives to help inform improvements, and also the process as a whole, and bringing those perspectives in. So we're not relying on a team of experts to come in to do the assessment. We're involving the folks who should care most about what's happening in this facility, which is folks from the jurisdiction itself. So you're going to see that reflected in the standards, but even more so in the tools that Doug and Beth have helped to develop as part of this process. So again, I think that's really exciting. I think that we're in an era where this process is more open and accessible to folks. And the thing that hasn't changed, and I'll wrap up with this, is that the standards, as Doug mentioned, are still the most demanding set of standards for juvenile facilities in this country. And that's intentionally so. That was true in part because JDAI sites who were undertaking JDAI were always striving to do better. This isn't the kind of assessment where you have an outsider come in and then you earn a certificate that you can put up on the wall of the facility's lobby or visitation room. This is something that's living, breathing, evolving, and that is designed to, again, help push folks to think about things that they may not have thought about, to partner in new ways to make new things possible, such as programming that may not have existed previously. This isn't a game of gotcha. It never has been. The conditions work as part of JDAI, but it's really, again, about elevating those things that are working well, but more importantly, identifying those areas where improvements can be made and providing a roadmap to see those changes. And then giving folks the opportunity to see the improvements that have been made. I mean, Portia did not ensure that there was a news article that came out, or a news clip that came out about the improvements in Dallas County the day before this webinar. That happened and organically. And, you know, we all know, I certainly know as a resident of Washington, D.C., that there's a lot of negative press right now about kids in the system and the system as a whole. And I think a lot of that the majority of that is monumentally unfair, because it denigrates the potential that we know all kids have. And it also diminishes the hard work of folks who are working within these systems and trying to do the best job possible. So I want to end on that and just say, for those of you who are thinking about this process and whether or not to move forward, I can't endorse it highly enough. And it's my main motivation for encouraging folks to undertake this work is to focus on the well-being of kids. But if you go about doing that, you will also make things better for the staff who have the tough jobs of working in these facilities too. And we know about the staffing shortages and attrition and challenges that were exacerbated during the pandemic and have still remained. So this is a process that, again, you'll see a clear focus on youth and family well-being. But if this is done well and taken seriously, staff in the facility are going to benefit from this work as well. And that benefits everybody. So with that, I'll stop and kick it back over to Doug. And thanks again for letting me be part of the presentation today.
Thanks, Jason. Jason, and the folks that he worked with, and part of our team, Saturday Garcia from our team, just did an incredible job going through these standards, making this revision. It was a tremendous amount of work, and I think the results so far kind of speak for themselves. But it's thank you for that dedication. It's hard to envision the impact that's going to have when you're knee deep and going through 900 standards and trying to cut them down. So we're going to keep it rolling and kind of flush out this picture of what are these new tools, and hand it over to Beth to talk us through kind of, there's the standards, but what else are we talking about here today?
Good question, Doug. What are we talking about? We're talking about the other two. Hi, everybody. I'm Beth Oprish. I'm physically located in Ohio, and thrilled to be part of this discussion today. So I want to talk about the other two kind of parts of the tools of the facility assessment process. One of Jason talked eloquently about the standards, and Portia and Rick about their participation in the process. But I want to underscore, this isn't a one and done, right? Like, the reason that we have this methodology is that we keep that internal. We develop that capacity within your site so that you can continue to do this. Nobody arrived, right? Nobody has it all figured out. There's always going to be parts to improve. And so this kind of gives us the map to this continuous improvement process. It's not for the faint of heart, right? But we give you the tools to help you. It's not supposed to be for the faint of heart. It's supposed to be hard because it's important. This is about the conditions that the kids are living in for a period of time that could be quite lengthy. So we applaud your interest and don't want to sell this as something that's easy. It's not easy and it's not supposed to be, but it's that important. So I think, Doug, you're going to put up a slide where I'm going to kind of show when you go to the website that Doug had up when he had the standards, you're going to see a place where you can download the standards. And then you're also going to see the training. So we could fly in Jason everywhere and we'd have beautiful assessments, but we wouldn't have the capacity to continue to do it. So we want to train local people, right? Now, Jason has a wealth of experience, right? So he could do this without a lot of training, but we also acknowledge that when we bring in community members and we bring in impacted youth and we bring in family members, they're going to have a little bit of the anxiety that Portia talked about, and so we want to coach them up. We want to train them up. So we've developed these courses for each of the areas of the standards. They're organized into this method we call chapters for each of the areas of the standards that we're looking at. And so there's a specific training on that to help the team member feel comfortable with going into the facility. There's also one about the facility assessment process that talks about who should be on the team, why it's important to have this community, why it's important to open the doors, the transparency that Rick talked about. And so the training is designed to kind of go through it yourself. It's a RISE course. It's a responsive kind of online training, but you also are coaching up the team lead in the site so they can work with the team members. So if I'm Portia, who is doesn't need much coaching, right? Doesn't need much instruction, but if she wants to go back to something, she always has this available to go back to kind of refresh her memory. So the training is one part, and that gets everybody kind of feeling a little bit more comfortable about going into the facility where they can observe, where they can interview, where they're looking at documents before, and the training will explain all that. One of the things that's really excited about this version of the standards and the update is this app that we have to go along with the standards. You know, once you go in and do the observation and the interviews and look at the documents, you still got to come up with a report, right? Like that's the blueprint for continuing this process to tell the facility what they've done well, what they need to work on, and then kind of sets the lays the foundation for what we're going to work on for the next assessment. So the report can be a little daunting, but this app has just made it a lot easier. So team members have access to this app. They score it while they're in the facility, and in real time, the numbers start adding up. This standard's been scored, this standard's been scored, that standard's been scored. And so it then can spit out a template or a report for what this facility assessment showed in this particular case. So every time a team member goes in there and notes something and scores something, you score each of the standards, either yes, no, sometimes or not enough information. And then you'll see this little bar graph, and that can all get or pie chart, I guess is what it is. It gets turned into the report. And so it just has really made that process much easier. And again, streamlined along with the standards. I could go on and on and on, but I'm going to stop because we want to allow time for questions and answers. But we're thrilled that you're here. We're available for questions, not just during this webinar, but afterwards. So thanks, everyone.
Thanks, Beth. That was great. I know when you say there's an app, people get real excited about it's the shiny new thing, right? But it is, it is kind of computerizing what used to be kind of a spreadsheet, process, a check off process. There's still facility members. We got facility members who are volunteers, part of citizen commissions, retirees. They're still going to go into the facility with a piece of paper and check it off, and they'll come back into their phone or their computer and fill out the answers, when they feel a little bit more comfortable doing that. But the bottom line is, if you're running an assessment, if you're the team lead on an assessment, you can see, who's got their scores in. How are things coming in? Are there some questions on, you can see, oh, you talked to a staff member or you talked to a youth. Why are we getting different answers from the youth and the staff member? How should we resolve that? At the end of the day, like Jason said, it's not a gotcha. No one's getting a license or, passing a state requirement based on this. So, but it's trying to get the best possible information to the leadership of the facility, because is as great as Rick is, there could be stuff going on in that facility that, he may not know about, that maybe newer staff that's had to come in and isn't, maybe in every instance the practice doesn't match the training they got or the policy that they had, and so triangulating that information is critical. I can tell you from our experience in different countries using the same methodology, interviewing youth, family members, staff. I mean, you really find out what's going on in that facility, and from a systemic standpoint, you're not uncovering individual. It's not the intention to uncover individual instances of, but from a systemic standpoint, how does this facility really operate? And we want to get you over those initial fears of engaging in in that process. So with that being said, people have been great answering. I'm going to end the poll here and I'm going to share those results so people can see that. Now it's going to add up to more than 100% on here because you could choose more than one response for these. But and while we're looking at those poll results, feel free to drop questions into the Q&A as well. But you see here that people are hopeful and excited about seeing how this is going to potentially could impact kids who are in their facilities. And transparency and oversight also hit high on there. I mean, I think that's those are can be scary words for us sometimes, but we got to get over that hump. And this is a structure. I think both Rick and Portia kind of talked to this. This is a structure to engage community, bring people in and say, be part of the solution, you know. And not everybody from the community who's maybe concerned about the facility in one way or another is a right fit for an assessment team. You want people who have some of that matter expertise, but also folks who are going to look for solutions, right? And join you in looking for solutions and bring that ball down the field. So this becomes a structure in which to do that. With that, I want to leave everybody with, well, before we do that, was there any questions between the panelists? You heard Rick or Portia say something. I had kind of a question for Rick. As not someone who doesn't run a facility, Rick, you talk about raising your hand to do this process, in your case, a self-assessment at your facility. But you've got state licensing requirements, maybe you got ACA stuff going on, maybe you're part of PBS and you're loading up your monthly reports. You know, how does that feel like it fits into this puzzle of all these other things that aren't isn't that doesn't that get us where we need to go, all of those other pieces? You're muted there. Or here, let me see if I can unmute you there, Rick. Uh-oh. Well, we'll have to save that for another time. Well, what we're going to do, folks, is again, I put up on the screen for a moment. I'll go ahead and put it up on the screen, and it's in the chat. There's a link out to our assessment resource hub where you can download the standards. You can sign up for the trainings. The trainings are free. You can just go and use those trainings whenever you want to. The standards are a PDF you can download. There is a tech fee that is involved for the web app for us to be able to kind of maintain the technology that is behind that. And then, but we can talk through that. If you have been part of JDAI in the past and done a self-assessment and you've been waiting to do your next self-assessment, boom, you've got the tools that are there and you can go ahead and off and run. And if you haven't done a self-assessment in a long time or you've never been part of this type of process, I would really encourage on the assessment resource hub at the bottom, there's a contact us form. You'll also get the follow-up emails from the webinar here. Let's get in touch. When you get in touch, you're gonna have questions for us. Should you do a self-assessment on your own, like Rick's team did? Should you do a hybrid approach like we did in Dallas County with Portia and the folks there? Jason talked about just is there a need to have an external team, which you're looking at it right with Rick and Jason and Beth, and I mean, we would still have some community members on even an external assessment team from your local community. But how much help would you need to get into that process? Those are all things that we would talk about and see what's the best fit for your facility. But nothing stopping you from getting those standards, pulling them down, get some good ideas in there, and and starting your journey on this path. So with that, we're at our time. I want to thank. Oh, Rick got unmuted.
Yeah,
Why
so
don't you go ahead,
I would
Rick?
just,
Yeah.
yeah, I would just say that everything that you talked about in the requirements that we are required to do within our facility, this is just a part of having the emphasis to support what you just talked about. And actually, it will help. It helped us do go more beyond of just what the minimum requirements are. It actually supports us to say we are exceeding in a lot of those areas that we had probably just, ultimately just doing the minimum, making sure that we're meeting the standards and making sure that we're meeting the requirements. But this assessment actually allows us to even go beyond what those requirements are statewide, and even some of those things that we have to continue on the national level. It just it's easy to merge everything that Doug, that you asked me about, into what we are expected to do. This assessment actually allowed us to be able to merge all those things. It made it actually better, as well as uh, almost uh, you wouldn't even know the change, because it merges so well. It married well with what our expectations were.
Hey, Doug, I know we're at time, but I also want to send people to Justice Link with, and we'll be integrating this information in the Justice Link, the resource for an online community for those interested in juvenile justice reform.
Great. I've just given an answer to one of the Q&As. I think it's a good point, especially with folks that found us on Justice Link. We'll be continuing to give updates there at Justice Link. The video will be up soon. Thank you, everybody, for participating. Thank you to Jason, Portia, Beth, Rick, and Gail D. Have a wonderful afternoon, everybody.